Melody. My name is Emily. I'm a student at YSU in their nurse practitioner program. I'm just going to ask you a few questions.
Okay.
If you could just answer them for me. So the first one, just tell me about yourself in the field here.
Well, I have to say I started out as a registered nurse back in 1999. So I have had a lengthy history of, bedside nursing before I obtained my nurse practitioner in 2017 at Franciscan University in Steubenville, Ohio. Since then, I have done an array of different kinds of roles, I could say. Done some freestanding clinics, a lot of geriatrics, and currently now I'm working as a pediatrician in a pediatrician office as well as this urgent care. And I've also started dabbling in the world of education to teach.
Oh, awesome. Okay. Can you describe your advanced practice role and include your specialty?
So my specialty, if I had to pick, even though, like I said, I'm a little bit of a jack of all trades, I've done a little bit of everything. My heart really is, I do love the geriatric community. I've taken care of geriatrics for a very long time. I enjoy that demographic, but I am capable of working all kinds of different demographics. And my job really, I do spend a lot of time getting to know the patient, trying to identify what their concern is or what the issue is so that we can appropriately treat them. I'm treating, I'm diagnosing, and I'm also order diagnostic to try and get to that decision-making process, whether it's a chest x-ray, an ultrasound, or even consulting another physician or specialty when you're limited on knowing where to go from there. But it's an ongoing process. It's not something to take lightly. It's an ongoing education process as well.
Okay. All right. Do you see the APRN influence in today's healthcare system? If so, why? And if not, why?
I absolutely do. I still see that there is a limited amount of physicians, and the advanced practice nurse really does fill that gap when we have such a high need for healthcare providers. And what is nice about your advanced nurse practitioners is because we were bedside nurses and nurses before, we hold a capability of connecting with our patient that sometimes the physician just cannot do. And I've had lots of times in my life where I've had my patients say, wow, no one's ever explained that to me like that before. But that comes back to our nursing days when that's what we did. We were the educator to our patient. We were always, educating them on what's next and what not to do. Whereas maybe the physician is missing that piece because they're just not part of what their practice is. But I definitely feel that advanced practice nurses, we filled this huge void, and I think we continue to have some benefit moving forward.
Yeah, I agree. Okay. What barriers do they face in contrast to what you just said?
So as a nurse, I guess it really just depends barrier-wise. It depends on where you're at in your practice. I have to say that I've been doing this now for 5 years or greater. I probably am faced with a few less barriers than maybe a very new nurse practitioner. I remember being a new nurse practitioner being very limited as to what I could get for a job. They didn't really want to entertain me. Now, I'm not sure if it's still the same now with new graduates, but the other unfortunate thing is we're living in a time where we absolutely are in crisis in healthcare. We need more providers, we need more nurses, and unfortunately when that occurs, you bring people into your workplace and maybe don't allot them that time they need to learn the job, or do we provide them the orientation they need? Oftentimes, and I see this in myself, which is fine because I've had a lot of experience, but I'm oftentimes just set into it. Here's 8 hours. I'm going to show you a couple things and good luck, So I think that's a barrier that we're not supporting and orienting and giving all the tools we need to all of our new nurse practitioners as well as new jobs, because therefore you're not going to retain staff, and we're going to continually have this tumultuous roller coaster of employment. And some other barriers too is just still the stigma of the nurse practitioner. Some physicians may still hold that thought process that they were not looked upon very well, which I think that's also moving in a different direction. Lots of physicians are happy to have us. But then you do have some physicians too who just really want the nurse practitioner to do their work, their scribing, the hard part of the job.
Yeah.
So
the bulk of them.
so there's some barriers there, but it comes down to your experience and your willingness to stand up for yourself.
Okay. All right. And then my last question for you is, what changes would you like to see for advanced practice nurses? And
I would love to practice independently without a collaborating physician. And that's only because, like I said, I've been doing this for so long. I see such a need sometimes, and it's a little restraining at times. Like if I could have my own practice, and of course, I think that's a whole nother conversation. I think there needs to be a lot of guidelines in who can practice independently as well. But I do see that there is a lot more great we can do if we could just be on our own. And we can to some degree, don't get me wrong, but it's just a little bit more difficult to kind of do. I think if we could open up some opportunities, I think we could flourish in a lot more different areas.
Yeah, I agree. Okay.
So,
all right. Well, thank you so much. That's all the questions I have.
You're welcome.
I really appreciate you taking the time out of your day to answer these for me.
Thank you. I hope it helped.
It did.
Okay. Thank you.
Thank you.